Tonight on the 7:30 report, the nation's future in their hands.
Almost half of childcare providers have no formal qualifications.
The push for better quality childcare.
The childcare sector in this country is in real crisis.
But first, childcare, and the federal government is about to start an investigation of the childcare industry to see what can be done to standardise the level of care and lift the qualifications of carers. At present, childcare services are covered by a mishmash of state and federal law, and almost half the workers in the industry have no formal qualifications. That situation doesn't sit well with experts in child development, who point to research indicating the importance of those early years in setting a course for life. To raise standards costs money, of course, but cash-strapped parents are unlikely to welcome the prospect of higher childcare fees. Heather Hewitt reports.
One hungry spider spun a web between two branches.
I think it's fair to say that the childcare sector in this country is in real crisis.
It's a very stressful job. There's a lot of hard work, there's a lot of hours. Looking after 5 babies by yourself, it's inhuman.
In Australia, we have this fairly alarming statistic that almost half of childcare providers have no formal qualifications.
If you spend money on staff, you need to get that money back in fees. And, you know, it's expensive.
I can touch the blue sky.
There are 1.5 million Australian children using some form of licensed government subsidised childcare. Debate rages about long waiting lists in some areas and the cost to parents. But has there been enough focus on the quality of care on offer, since medical research shows brain development is at its most crucial phase from birth to the age of 3?
I think the research tells us very clearly now that the early years of a child's life are extraordinarily important, not just for the child, but in terms of long-term development. And what it tells us is that the developing brain is very, very sensitive to the quality of the caretaking environment.
Professor Frank Oberclade heads the Centre for Community Child Health at Melbourne's Royal Children's Hospital. Along with many other child specialists, he's convinced that the sort of relationships a young child has with his or her caregivers is critical in laying the foundation for the future success of that child.
A banana and an apple and an orange, wow.
And he fears society will pay a heavy price if governments don't take steps to lift the standards of childcare services nationwide.
And indeed, there's evidence that where young children don't have a positive early environment, where the relationship isn't as good as it can be, that has consequences right through adult life. So many of the conditions we see in adult life, like mental health problems, like violence, like participation in crime, often have their roots in those early years.
A vegetable pie.
And yet, only about half of the workers at childcare centres have any form of qualifications in their field. Many are on the minimum wage, and there's a massive turnover of staff.
Over 30% nationally, and in some states as high as 60%. Now that's just phenomenal. And what we're seeing is a lot of young women coming into the sector, doing their first year or so's training and then exiting. Just because the wages are such, the workload is such, the lack of recognition, that they're better off to go off with their mates and work in telemarketing, and they'll do better.
The union representing childcare workers says stress levels in the industry have never been higher. Group sizes and staff-child ratios in many cases are stretched to the absolute legal limit. For this young worker, Christy Jones, that means looking after 5 babies on her own at an inner suburban Melbourne centre. She's 21 years old and unqualified, though she's studying after work to try to get a childcare certificate.
Every day there's times when there's 3 babies crying and you just feel helpless because you want to help them all, but when you're one person you can only do so much.
Is that upsetting for you?
Oh, definitely. There's a lot of days I go home and I'm so frustrated and annoyed that I couldn't do better or do more.
I don't know too many mothers who could look after 5 babies. But that is the regulation. No one's breaking the law doing that. That is what state regulations for the most part require. One often very young person with a minimum qualification looking after 5 babies. I don't think that's good enough.
Hello, Mr. Rudd.
The federal government made early childhood development and learning one of the centrepieces of the last election campaign. Later this week, it begins meeting industry experts about how to improve childcare quality, and will also hold talks with state ministers on how to fix what's become a very cumbersome system.
It's just a mess really when you look at care. We've got state regulations that all vary, we've got federal policy that's at variance.
We've had buckets of money being put into the childcare sector for years, and very little has been demanded in return. Well, that's over.
Oh, well done.
Exactly what that means is not entirely clear yet, but reviewing staff ratios per child in care looks set to be high on the agenda. At the moment, it's the states that set staffing ratios for childcare centres. 1 staff member per 5 babies is pretty much the norm. Beyond that age group, it varies from state to state.
In Victoria, the ratios are that we need to have 1 staff member for every 15 children over 3, which again I think is poor. And that's just staff members, and then there are different regulations about whether those staff need to be qualified.
Now, how you can do any sort of individual programming, any sort of development work with that number, that's just crowd control.
What parents really care about is when they pick up the child at the end of the day, he or she is in the same condition as when they drop them off in the morning.
Okay, we're going to have a story soon, a special story.
And that appears to be the general sentiment that's guided state regulations for years, to the point where workers like Christy Jones say they feel they're viewed as nothing more than childminders and don't have the community's respect.
It's just like we're there just to look after them for the day, and that we don't train them or teach them or give them the love. I love them like they could be my own children.
Staff qualities and a love of children don't exactly dominate the picture when applying to set up a childcare centre. An operator must meet state building regulations, playground sizes and fencing heights, which also vary from state to state. Sometime down the track, the national accreditation body checks out whether the centre is operating properly. As the number of centres has grown, so too has the bureaucracy that governs them.
Looking at quality and the direction of quality assurance.
The National Childcare Accreditation Body tries to keep tabs on at least 8,000 childcare services.
For some of our services now, we're into like 700 indicators that get assessed at one visit, and that's a lot to work through.
I've been running this centre for over 20 years. And in that 20 years, I can tell you that the administrative paperwork has just got out of control.
With no real proof that all that paperwork has boosted quality. Now the federal government wants a national, streamlined set of standards. Central to this is a push to get more child workers trained. From the start of next year, it will drop TAFE fees for childcare diplomas.
We're basically saying to every provider of a childcare centre, if you've got people who are unqualified, get them enrolled in a diploma course and then perhaps an associate diploma course, and we will pay for that. That is a direct subsidy to employers.
But will employers rush to take this up if training leads to higher salaries?
Any way that you increase your expenditure on staff, whether it's by employing more staff or more highly qualified staff or more experienced staff or offering them better training opportunities, it's going to cost you and will have to be recouped in fees.
What if this means increased fees for parents who are already struggling to meet childcare fees?
I think we have to revisit that. We've got an education system, a public education system, which is ostensibly free, that's been in existence for 100 years. Why is there a childcare system that parents have to pay for?
It's a question I field a lot. But at this stage, we are working with the financial mechanisms we have.
Clearly there are some limits, despite new funding pledges for early learning that the industry hopes will lead to a new era. While the government can't guarantee there won't be fee increases, it's adamant they should not be necessary.
Heather Hewitt with that report.